Hi, I'm Monica, and this presentation is just going to hit the high points of what informed consent is and why we need it. So basically, it's a form that says that the patient understands what the procedure they're having done entails and why they're having it done. We do also need to list the risks and alternatives, and that has to be done by the surgeon who's performing it. They also need to understand who is performing it. If their doctor recommended it, but he's not the surgeon, that's important that that's noted on the consent and that the person who is consenting them is the person doing the procedure. So some of the critical elements are listing who the surgeon is, the procedure, the site, and the laterality, if it is a right or left possibility, any assistants that are included, risks such as blood loss, and typically there's an additional consent for transfusion that they may accept or reject. What happens to any tissues that are removed? This is extremely important when we're talking a DNC or anything else that might involve fetal tissue potentially. A lot of states have different regulations as far as what we do with that. So they need to know if. But why do we do this? Well, accrediting and licensing bodies say we have to. Facility policies usually say we have to. It's a standard of practice that our patients are informed about what we are doing for them, from simple things like a bed bath or an IV where we explain why we're doing it and what we're doing. But essentially, it's just an ethical obligation. Our patients need to understand what's going to happen to them when they're asleep, and that they have options to refuse things or options to at least know what the risks might be. So where are informed consents used? Not just in surgery. Any invasive procedure, anesthesia usually has a separate consent. Pain management and other injections sometimes have consent forms. Obstetrics is probably the big one. I had a patient come for an induction who did not know why she was being induced. She wasn't worried about it, but I was worried about it. I didn't have her sign until the provider came to do the gel or the gauze and could explain why she was being induced at 38 weeks. That's just good care and good practice to make sure that the patient knows why they're having something done. And that is truly the biggest part of informed consent. Minor procedures sometimes need different forms or formats of this, but essentially the patient needs to be informed and sign that they are informed, and they have to have been informed by the person who's going to perform the procedure. I hope that makes informed consent a little more clear for you.